Pregnancy and Associated Disorders lecture. Fertilization. For pregnancy to occur, the vagina must receive sperm from the male. Sperm moves up through the opening of the cervix, or the cervical os, through the uterus and into the fallopian tubes. Fertilization occurs when one sperm cell penetrates and fertilizes an egg. Tiny fertilized ovum, or zygote, moves by peristalsis and a massaging motion of the cilia that line the fallopian tubes into the uterus and implants itself into the uterine wall. The placenta forms to nourish an embryo. Pregnancy, anatomy, and physiology. The zygote formed when fertilization occurs. It implants into the uterine wall about 5 to 6 days, while cells continue to multiply. The placenta forms within the uterine wall. The fetus encased in an amniotic sac filled with fluid. The next stage of development is the embryonic period, which includes the 3rd to the 12th week of pregnancy or the first trimester. Why is the embryonic period such a crucial time for developing fetus? This is when all tissues and organs develop, hence why it is so important for maternal nutrition and health. HCG is the human chorionic gonadotropin. This is the hormone level that is elevated when a woman becomes pregnant. Serum HCG levels increase and spill into the urine, which results in a positive urine pregnancy test. Trimesters and Parturition. The first trimester is weeks 1 through 14. It is really important for nutrition and health, and to avoid any tetragens, such as alcohol, smoking, drugs, and other things that may harm the fetus. This also is a period of time when morning sickness is most prevalent. Morning sickness usually resolves around weeks 12 to 16. Morning sickness consists of nausea and vomiting. Sometimes excessive weight loss and metabolic imbalances can occur, which is called hyperemesis gravidarum. In severe cases, IV fluids may be needed to help mother not become dehydrated. Things that a mother can do to prevent or minimize morning sickness is to avoid foods or smells that may trigger. They can also try taking ginger, vitamin B6, and vitamin B12. Second trimester is the weeks 15 through 28, which the first fetal movements are felt, called quickening. The third semester is weeks 29 to delivery. Rapid fetal growth happens, and about 1 pound per week is gained by the fetus. Parturition includes labor and delivery. Parturition, to be born vaginally, the baby must drop down into the pelvic floor and the cervix must efface, thin out, and dilate, open up. What is dilation? Dilation is the opening of the cervix, which allows the infant to pass out of the uterus and into the vaginal birth canal. Stages of labor and delivery. Stage 1 is dilation and effacement. Stage 2 is birth of the fetus. And stage 3 is the expulsion of placenta and amniotic membranes. Your book is a little confusing on the 3 stages of delivery, so to answer your study guide and for testing purposes, please go by this PowerPoint slide to answer the questions. Ectopic pregnancies. An ectopic pregnancy is one that occurs outside the uterus, although an ectopic pregnancy can develop on or near the ovary or an abdominal cavity. Most occur in the fallopian tubes. Rupture of the fallopian tube containing an ectopic pregnancy is a serious event and requires surgical intervention to prevent fetal hemorrhage. However, if an ectopic pregnancy is caught early enough, methotrexate can be administered to cause the placenta to die and the products to be reabsorbed by the body. However, this needs to happen in early stages. Abortions and miscarriages. You will want to know the difference between the abortions and miscarriages. Spontaneous is an abortion that does not have an identifiable cause and typically happens before the 20th week. Complete abortion is the complete expulsion of both the fetus and the placenta with no medical intervention. Incomplete abortion is the expulsion of only parts of the fetus and placenta occur. Missed abortion is the fetus dies in utero and must be removed surgically. Threatened abortion is a cervical bleeding occurs, but dilation does not, and pregnancy continues uninterrupted. Miscarriages are estimated to be about 1 in 3 pregnancies and terminated by a naturally occurring abortion. And in most cases, the cause is not clear. Some common causes are defective development of the embryo, abnormalities of the placenta, endocrine disorders, malnutrition, infection, drug reaction, blood group incompatibilities, which do not happen commonly today due to the drug program, and several trauma or severe trauma and shock. Placenta Previa. The placenta implants in the lower uterine segment. The placenta is implanted on or near the cervix. When the mother goes into labor, dilation and effacement of the cervix can cause the placenta to tear loose. Abruptio Placentae is when the placenta detaches from the uterine wall. This is a true obstetric emergency and requires immediate cesarean delivery to save the infant and the mother. Neural tube defects, a congenital defect in the brain or spinal column that occurs during embryonic development. An elevated alpha-fetoprotein level can indicate these neural tube defects. Folic acid supplements are often used to prevent neural tube defects. Maternal disorders. Gestational diabetes, or GDM, is any degree of impaired glucose tolerance during pregnancy. Responsibilities include performing blood tests as ordered, completing routine urinary dipstick tests at each visit, ordering and obtaining postprandial glucose testing, or also called a glucose challenge test, to identify women who have gestational diabetes, and provide a referral to dietitians to help with diet, therapy, and management. Other maternal disorders are gestational hypertension or pregnancy-induced hypertension that can be mild to severe and occur in approximately 10 to 15% of pregnancies. Hypertension accompanied by proteinuria after 20 weeks of pregnancy indicates preeclampsia or toxemia. The patient is at risk of severe headaches, vision disturbances, oliguria, and convulsions either before or during labor. If preeclampsia is early in pregnancy, the baby is monitored with a routine non-stress test, sonograms, and maternal reports of fetal movement. Responsibilities of the MA include, and doctor, monitoring of the pregnant women's vital signs, reporting sudden weight gains, and performing routine urine dipstick testing to monitor protein in the urine. Infertility. The potential causes of infertility are history of sexually transmitted diseases or infections, failure to ovulate or irregular ovulation, congenital anomalies of the reproductive organs, endometriosis, medications that can reduce fertility, and advancing age. Some of the treatments for infertility are in vitro fertilization. Medications such as Pergonal, Clomid, metformin can sometimes be used, and fulvestrant can also be used. Another treatment that is sometimes tried is the intrauterine insemination.